Conversation 1. Conversation between doctor and patient about fever. Good morning, doctor. May I come in?
Good morning. How do you feel? You appear rather pale today.
Indeed, doctor. I've not been feeling well for the past few days, and I've felt somewhat lightheaded since yesterday.
All right, allow me to verify. Pushes in the stomach and feels for discomfort. Is this area hurting?
Yes, doctor. The pain there is the sharpest.
Well, you are suffering from a stomach infection. That's the reason you are having a stomachache and also getting dizzy. Did you change your diet recently or have something unhealthy?
Actually, I went to a fair last week and ate food from the stalls there.
Okay, so you are probably suffering from food poisoning, since the food stalls in fairs are quite unhygienic. There's a high chance those uncovered food might have caused food poisoning.
I think I will never eat from any unhygienic place in the future.
That's good. I'm prescribing some medicines. Have them for 1 week and come back for a checkup next week. And please try to avoid spicy and fried foods for now.
Okay, doctor, thank you.
Welcome.
Conversation 2. Conversation between doctor and patient about an eye infection.
Good afternoon. How can I help you today?
Hi. I've been having some discomfort in my left eye and it's been a bit red and itchy.
I see. When did this start?
About 2 days ago. It's been bothering me a lot.
It sounds like you might have an eye infection. Have you been experiencing any discharge or blurry vision?
Yes. There's been some yellowish discharge and my vision is a bit blurry.
Okay. It's important that we treat this promptly to avoid any further complications. I'll prescribe you some antibiotic eye drops. To help clear up the infection, make sure to use them as directed.
Thank you, doctor. Should I avoid wearing contact lenses until it clears up?
Yes. It's best to avoid wearing contacts until your eye is completely healed. And remember to practice good hygiene, like washing your hands frequently and not touching your eyes.
Will do. Thank you for your help, doctor.
You're welcome. If you have any other concerns or if your symptoms worsen, don't hesitate to give us a call. Take care.
Conversation 3. Conversation between doctor and patient about bronchitis, a common respiratory infection.
Good morning. How can I help you today?
Hi. I've been feeling really fatigued lately and experiencing a persistent cough. I'm a bit concerned.
I see. Let me check your symptoms. How long have you been feeling this way?
It's been about 2 weeks ago.
Based on your symptoms, it seems like you may have bronchitis, a common respiratory infection. Have you had a fever or shortness of breath as well?
No, not really. Just the cough and fatigue.
I'll recommend some tests to confirm the diagnosis. In the meantime, get plenty of rest, stay hydrated, and avoid smoking or exposure to second-hand smoke. I'll prescribe a medication to help alleviate your symptoms.
Thank you, doctor. I appreciate your help.
You're welcome. If your symptoms worsen or you have trouble breathing, don't hesitate to come back for a follow-up appointment.
I will definitely keep that in mind. Thank you again.
Take care and get well soon.
Conversation 4. Conversation between doctor and patient about cancer.
Good morning. How are you feeling today?
Not too good, doctor. I've been worried about some symptoms I've been experiencing lately.
I understand. What symptoms have you been noticing?
I've been feeling very fatigued, and I've noticed some unusual lumps in my breast.
I see. it's important to address these concerns. I'd like to run some tests to get a better understanding of what might be going on.
I'm really scared, doctor. Could it be cancer?
I can't say for sure without the tests, but we need to investigate further.
What if it is cancer? What are my options?
If it is cancer, we will discuss treatment options tailored to your specific situation. It's important to stay positive and take things one step at a time.
Thank you, doctor. I appreciate your support and guidance.
Of course. I'm here to help you through this every step of the way. Let's get you scheduled for those tests and start moving forward.
Conversation 5. Conversation between doctor and patient about HIV/AIDS.
Good afternoon. How can I help you today?
Hi, doctor. I recently got tested for HIV/AIDS, and I'm really worried about the results.
It's good that you got tested. Can you share with me your concerns?
I've been feeling unwell lately, and I've read that these could be symptoms of HIV/AIDS. I'm scared and don't know what to do.
I understand your fears, but having symptoms doesn't necessarily mean you have HIV or AIDS. The only way to know for sure is through testing. Have you engaged in any high-risk behaviors?
I have had unprotected sex a few times in the past year.
That is a risk factor, but remember, HIV/AIDS is manageable with early detection and treatment. Let's discuss your test results and your treatment options once we have them.
Thank you, doctor. I appreciate your support and guidance.
You're welcome. Remember, we're in this together, and I'm here to help you every step of the way.
Conversation 6. Conversation between doctor and patient about tobacco.
Good morning. How are you feeling today?
Hi, doctor. I've been doing okay, but I've been thinking about quitting tobacco.
That's great to hear. Tobacco can have serious health risks. Have you tried quitting before?
Yeah, I've tried a few times, but I always go back to it.
Quitting can be tough, but it's important for your health. Have you thought about the reasons why you want to quit?
Well, I know it's bad for my lungs and heart, and it's expensive too.
Those are all valid reasons. Quitting tobacco can improve your overall health and save you money in the long run. Have you considered using nicotine replacement therapy or other methods to help quit?
I haven't really looked into it, but I'm willing to try anything at this point.
That's a good attitude to have. I can provide you with resources and support to help you quit successfully. Let's work together on a plan to kick the habit for good.
Thank you, doctor. I appreciate your help and guidance. I'm ready to make a change.